Hello, dear friends. So it is being very important that I am in front of you and talking regarding the treatment modalities, different treatment modalities, and the philosophy. So it is being since very long time. I am on the X, that is formerly it was Twitter, and there have been number of controversies regarding treatment modalities between modern medicine and alternative system of medicine, and their own significances. So, so limitations and scope is are the important parts in each and every therapeutic measures, especially by consideration of modern medicine and CAM, that is called alternative medicines. So it is has its own scopes and its own limitations, and there have been number of people those who are taking in part in that controversies that whether modern medicine is really effective or not, whether homeopathy or ayurveda or other alternative system of medicine is effective or not. So just, and they are giving certain measures, they're giving certain documents, especially the research work, and some documents which is showing efficacy or inefficacy of system of medicines. So I am in front of you and talking about the importance of principles, especially in healthcare system. So ultimately, uh, in undergraduate course, we have learned about all anatomy, physiology, pathology, medicine, and so many things that every doctor should have learned in order to treat the patient. So we know about how our body works, how our organs are working, how the disease is developing in the patients. So all these things we learn in undergraduate syllabus, and which is of course very similar to all the undergraduate courses, especially in India, that is for MBBS, BMS, BHMS, and other faculties. And the very controversial point that comes in where the therapeutic measures are different, especially for MBBS, that is completely allopathy or modern medicine, whatever they call, or for BMS it is Ayurveda, and for BHMS it homeopathy. But whatever that allied knowledge that we have all together learned is the same, but only the part that differs is treatment part. And the principles I'm going to talk about, whether in the treatment modality whether principle plays important role or not. So significantly, I'll tell that principle plays very important role in the medical or therapeutic measures. Because when we studied about the evolution of medicine, especially about modern medicine, the treatment part or treatment principles are always being changed. Say for example, for particular disease, say for example in cardiovascular diseases, the reasons, the causes of cardiovascular diseases are always being changed in some centuries, and treatment modality has been changed after the certain modification, or so many even in other diseases or communicable or non-communicable diseases as well. So it was always changing. The change of definitely is good part also is there and bad part also is there. So a man, those who knows his own limitations, because before entering into the therapeutic intervention, one must learn very first. One must the limitations first. Then their scope must be. They must imbibe their scope. So one man, if they don't know about the limitations of our science, then I don't think whether it is wise or not. So that's how principle plays very important role. So the principle of modern medicine or allopathy is ever changing, and that's a very good in the one sense that it is beneficial. Some new things that have been coming up that is benefited for the patient. But the very bad part is that the people that's undergone with that therapeutic intervention, they may suffer in the future a lot. So that the part, or those people who are taking the evidences or researchers, especially in the modern medicine point has been concerned. So I am here since 2019. I'm working as an individual researcher on the different sectors. And what I learn about the researchers, especially in India, the research that should be happen, that it should be useful at certain period of time for people. The research should not be just you are invented something, or you have something that you have gathered from somewhere, and which is not especially useful as such. So many times Indian research has been saying that the research is irrelevant to the social need, and which is happening all around India, or defaming the other pathies or other system of medicine. As per homeopathy has been concerned, so research methodology in biostatistics is was not part of our syllabus previously. Since very long time, those student or those people who have been passed their undergraduate or postgraduate, so they don't know about research methodology in biostatistics. But nowadays, in our postgraduate graduate syllabus, we have research methodology in biostatistics. Nowadays, it also included in undergraduate syllabus, that is for UG courses as well. So it is very good thing to at least understand how the research is going on, international researches are going on, how the research process is being is actually come out of into plans. But one thing that I especially learned, that the biostatistics or research methodology nowadays they're teaching, we are learning, it is completely based on certain parametric knowledges or parametric evaluations. Especially it is used for quantitative figures, but it is not possible in homeopathy. Even randomized control trials or preclinical trials or anything, especially that comes under the biostatistics and research methodology, are not suitable in homeopathy. The reason is that homeopathic treatment is definitely based on individualistic approach. We're giving the medicine on patient's constitution, patient's temperament. Even we are selecting the medicine or selecting the potency of doses according to patient's differentiation. So that's the basic thing, or the law that we are using, that is law of similia simillimus or minimum dose, or law of individuality is, as a general part of homeopathy, that is individualization is the key to prescription. So no one, if we consider about four typhoid patient, so each medicine or repetition of doses will be different from patient to patient. Then how could we can uh, use the randomized control trials in the patients? And there have been certain people, those who are doing, especially from the more modern medicine practitioners, so they even don't learn about the principles of homeopathy, and they are using randomized control trials, and they're showing that yes, homeopathy is not effective and all that thing. So but certainly when we giving these kind of medicines on individualistic manner, so it's showing such miraculous result that it is astonishing to all modern medicine practitioners, that since a very long time they are taking a lot of degrees, but they don't have weapons. So say for example, those people like rheumatologists, they actually medicines is advanced. It is very good thing, but technically, or what we are called equipments are very developed in this era. But the substitute practice are much more in modern medicine. Say for example, if a patient is suffering from hypothyroidism, it is they are giving some thyroxine, that is they are just substituting something. Or if a patient undergone liver cirrhosis, just transplant it, give others livers to that, whether it is curative treatment or not, whether it is really curative. So in that context, that homeopathy is really wonderful in that way, that it is whether those people who have taken a lot of education in modern medicine, but at the whenever it comes to the medicine part, they don't have any medicine. Say for example, if a rheumatologist, those who are taken a degree DM rheumatologist, but whenever actually it comes to the treatment part, whenever they actually treating the patient, of rheumatoid arthritis, they don't have any medications. uh, Only medications are available, that is steroids and painkillers. But how far the treatment part is concerned, whether the steroids or painkillers are really, uh, how much time we can give it to the patient, or whether it is effective or not, whether it is called a cure or real treatment or not. On the counterpart, with homeopathy, there have been number of diseases which is actually curing without modern medicine help. In certain cases, definitely we need help, because symptom elevation is also important in the part. But there have been number of diseases which is we are getting cure, we are getting success to cure that patients, which is not with modern medicine. So I'm not taking it controversial, but I definitely, I just wanted to express myself in that way, that principle based treatment are always necessary. What they are talking about, that homeopathic principle as just set forth by Hahnemann, and since very long time, and it never been changed. I don't think that whether it was need change, because it been principled, and on that principle or on that laws, if we use the medicines and patient getting benefited out of that, so it is principle based treatment. And the principle on the counterpart of modern medicine is ever changing, that becomes hazardous in many times for the patients as well. So I think principle based treatment is always and important, especially even Ayurveda part also concerned, homeopathy also concerned. So principle based treatment are necessary all the time. But before entering into the therapeutic measure, one must know our limitations. We also have, as a homeopath, we also have a lot of limitations, including so we have to understand the scope and limitation of our system of medicine. So before making an controversial point, we must accept the situations or scope and limitation, and then we definitely think for the betterment of the patients. So ultimately, we are not here to point out or anyone's lack or anyone's whatever the things, but here we are doctors to just benefit something for suffering humanity. So I think that should be our prime motto, and we must work upon it. So thank you so much.